So what we're going to do, Harriet,
Yeah.
is we're going to do something that I call your home exercise program. So these are things you can do when you're sitting at a table. Patients need to be instructed in a home exercise program in order to maintain range and prevent contractures. And since Ruth comes and visits from across the street every couple days, she could even do it with you and kind of help remind you, you know. I normally instruct my patients to do this at least once a day. I have them do the exercises in sitting, but some can be modified to be done in supine. Start with a good base of support. Their feet should be flat on the floor, and they should be out of a posterior pelvic tilt. And I'm going to do it too. And the first one we're going to do is we're going to stretch all the way forward as far as you can reach. That's it. That's good. And come back. And I usually do everything 10 times.
Yeah.
So we'll do it again. All the way. We work proximal to distal, beginning with the trunk and shoulders, and then working on to the wrist and fingers. All the way. And when you stretch all the way out, there you go. That's better. And kind of hold it for a second and come back. So we would do that like 10 times. It's just easy to remember tens. And back. But I don't want you just going da-da-da-da-da-da-da. Okay, go all the way forward and all the way for a big stretch. Good. And come back. Now the next time we do that, after we've done 10 of those, we're going to go all the way forward. And while you're forward, roll to your right side. That's it. And then we're going to have you roll to your left side. And then roll to your right side again. Stretch your sides. And come back. Perfect. Go to the left. Hold it. And come back. And sit up. Now another thing you can do is bring your arms up as high as you can up overhead. That's right. Good. And back down. Come up again. Good. Great. And I would have you do that 10 times too. And you always go just to the point that you feel resistance or it hurts. Now, do you have a hold? Okay. Okay, and straighten your elbows and up overhead. Good, all the way. Nice. Come back. Really nice. Those are the shoulder exercises. Now we're going to do your lower arm. Whoop, whoop, whoop. Keep your fingers together. And we're going to go like this, Harriet. Palm side up, palm side down. So it'd be like that, And palm side up. Feel that little stretch? And palm side down. Palm side up. Palm side down. That's right. That's not hard, is it? No. Now while your hands are together, just bring your wrists, your elbows up like this. And then what we're going to do, look this way, Harriet. What we're going to do is your wrist. Yeah, exactly. And again, if anything hurts, you don't force anything. Just, it shouldn't hurt. It just might stretch a little tiny bit. And then you can do the other side. Yeah, exactly. And then come back over. And bring your wrist like this. Exactly. And down. And stretch. Stretch all the way out one last time. Let your hands come apart. And try putting this hand flat on the table. This one. While you're still all the way forward. And if you notice, here we'll take your strong hand away for a second. Do you see how your fingers are relaxed and they're not curled at all? Look at this. And when you stretch your arms out like you did, look how nice your hand stays open and it doesn't curl up like that. And then you can just sit up straight real slow. Do you see how nice your hand stays? If you do that every day, then you don't have to worry about that hand getting tight.
Oh, yeah.
You know? And it's nice and relaxed. We'll start out by putting our hands together like this.
Okay.
Like that would be perfect. And we're going to have you bring your arms up on the table. I like to teach the home exercise program in a group. Your group could meet on a daily basis or 2 or 3 times a week, depending on the setting. Have your patients sit around a table large enough that they can really reach and stretch. Sometimes it helps to put 2 tables together. Now let's all go towards the center again. Oh, reach as far as it's comfortable for you. Good. And when I do these, I usually do these 10 times. Peggy, over here. Oh, good. Eileen, I can't reach that far. Okay. Oh, you guys can touch. Great. Can you guys touch, Johnny? It helps when they interact with each other. Giving each other a morning greeting can encourage them to turn their heads toward the weak side, which is great for those patients who have a neglect. Okay, everybody ready? This time we're going to go lean towards the center again. And I want you to roll over your right shoulder. Just roll over your right shoulder a little bit. And again, if anything hurts you, stop, okay? But it shouldn't hurt. And then stretch way out, Peggy. And we're going to roll the other way over the left shoulder. And then lean towards the side a little bit.
Towards the left.
Yeah. So for the therapist, what we're doing is we're doing some protraction with weight bearing. And we'll just be available and go around the table to help each patient. I never just sit in my chair to lead the group. And we would do that 10 times. So we would lean to the right. And then we would lean to the left. Okay, now the next one is going to be pronation and supination. So we're going to go palm side up and palm side down. And Eileen has trouble with pronation and supination, so what is she using to substitute? Internal and external rotation. So Eileen, I want you to try to keep your elbows on the table if you can. And I know it's going to be hard for you because of your fracture, okay? So you're just going to do as gently as you can, palm side up and palm side down. Johnny, you were doing that really well. I often ask the patients to take turns leading the program. That way I know that they have remembered each exercise in the correct order. Great, Peggy. And palm side up. You know what? Your hands are loose enough now. We can put your hands together. Look how your fingers have loosened up now. Do you feel that? So now we can do it like that, and that's even better for you.